Extra. There's an upcoming workshop for survivors and caregivers being sponsored by the American Cancer Society as well as Public Health. Our next guest tonight were brought to Guam to help lead discussions and training on palliative care. Please welcome Clinical Assistant Professor of Geriatric Medicine at UH, their School of Medicine, Dr. Ray Seitz, and from the Guam Cancer Coalition, Miss Angie Mummert. Ladies, half a day.
Half a day.
All right, thank you so much for being here. So, first off, palliative care, and I hope I'm pronouncing that correctly.
Good enough.
Okay, good enough. Okay.
Yeah.
That sounds like my formative years in school. But what exactly is palliative care? Because I mean, that's a term that not that many people may have heard of it.
Angie, can I
think I defer to her because she's the expert in that.
All right. Palliative care is a new specialty in medicine, and it's directed at this point in time towards the care of people who suffer from serious life-threatening illnesses or illnesses that are chronic and incurable, or even terminal illnesses. It's a new discipline, one in which doctors work with nurses, social workers, therapists, chaplains, in order to give holistic care to patients who are suffering from really terrible disease. And what we find is that when a person has a very serious illness, their care can be very complicated, their needs many. And so we need a whole team of people in order to help these patients, number one, get the best out of whatever treatments we're offering them. Number two, to live their lives as well as possible. And so that's what, in a nutshell, palliative care is.
Does this parallel in any way or complement hospice care? Because I know, we've done stories with some of the hospice professionals on island and everything. So how do those relate?
Hospice care is a type of palliative care that is directed for the very end of life. But palliative care can occur anywhere in the continuum of care, from the time of diagnosis all the way to the end of life.
Okay. Now, Angie, of course, you are with the Guam Cancer Coalition, and you're the outgoing chairperson and everything.
That's correct.
How have you incorporated some of the lessons and the methodologies and the science and and more so the philosophies of palliative care into your curriculum?
Well, actually, it's not really a curriculum, but we developed a Guam Comprehensive Cancer Control Plan, and within that plan we identified certain priorities, and cancer survivorship and quality of life was one of them. And through needs assessment, we determined that there was a need for that, and because of that, we wanted to be able to bring experts to the island and to help us develop a palliative care program on the island.
Now, Dr. Seitz, we'll go back to you. So obviously, because as you said, this is a relatively new branch of medicine, so it would undoubtedly be progressive and probably evolutionary.
Yes.
How has the medical community at large, reacted to it, and what inputs have your colleagues given you?
Well, after a somewhat slow start, palliative care as a discipline has really taken off. So now we're a specialty that's recognized by the American Board of Medical Specialties. And so you can sit for the boards for that. You get special fellowship training. There are programs now all over the United States. Almost, 70% of hospitals with more than 250 beds in the United States have a palliative care program associated with it. All the VA hospitals have some sort of palliative care. People are really taking to this kind of medicine, in part because it really harkens back to why we became doctors and nurses in the first place. In order to do good palliative care, you have to really know your patients. You have to spend the time talking with them and listening to them, understanding what their values, their goals, their hopes are. And so it enables us to become so much closer to our patients, and we love it. It's what we went to medical school and nursing school to do. So many, many more people are sitting for their boards and becoming specialists in this field.
Almost like a back to basics approach. Almost.
Exactly. Okay. It's exactly right.
Okay. Well, obviously this is from a conference and everything. So what can attendees expect to see, and how will they be able to interact with experts like Dr. Seitz as well as with each other?
On Wednesday is the workshop for healthcare professionals, and they're actually going to go through a curriculum that was developed by Dr. Seitz and also with the Kokua Mau. And they're going to go through talking story, how to talk to your patient about pain, how to talk about palliative care, about death and dying also. And then on Friday, on June 17th, is for the community. And what we're going to be providing there is, the theme is Celebrating Life, a conference for survivors. And it's very interactive, and there's really a whole lot of things that are going to be going on there. We have great presenters, including Dr. Seitz, who will be there talking about palliative care, talking about advanced directives, also talking about how to talk to your doctor about pain, you know, because a lot of people are very subdued when it comes to talking about their pain and sharing it with other people. We're also going to have talk about nutrition, and in the afternoon, there's going to be a segment or concurrent sessions on escapes me right now, but I think there is a session on,
I think, caring for yourself.
Caring for yourself.
Yoga,
there you go. Thank you. Oh, she remembered.
Things like that.
And that's where the holistic approach would come in. And
I think for caregivers or survivors, you know, to either care for someone with a serious illness or to have gone through that themselves, there's a real need to then pay attention to your own health and your own care.
Okay.
And so that's where these self-care workshops are going to
Okay,
take
well,
place.
unfortunately, we got to go to commercial break, so I just got to say, where is the conference, and once again, when can people check it out, because it's on Wednesday?
The workshop on Wednesday, we're full up, but the conference on Friday, which is for the community, that, again, is going to be at the Holiday Resort and Spa, and it's going to be from 8 to 5 in the afternoon.
All right, Angie Mummer, Dr. Ray Seitz, thank you so much for your insight. Okay.